Many people do not know that pancreatic cancer is one of the most dangerous cancers today. The mortality rate from this disease has surpassed that of breast and prostate cancer in many countries. But it is rarely mentioned in the media. Hard to believe, right? Just by recognizing a few warning signs, you can help yourself or a loved one detect the disease in time, before it's too late. Pancreatic cancer is called the silent killer for a reason. The 5-year survival rate is only about 12%, largely because this disease is very good at hiding in the body, taking the lives of more than 65,000 people each year in the United States. What's even scarier is that nearly 80% of patients do not pay attention to the early signs, often thinking it is a small matter or just a normal digestive disorder. However, new research shows that many warning signs can appear 3 to 6 months before a formal diagnosis, creating a rare opportunity for early intervention. The pancreas, though small and located deep in the abdomen, plays a vital role in regulating blood sugar and digesting food. Because of its hidden location, tumors can grow silently without attracting attention, making early detection extremely important. In this video, we review 8 unexpected signs of pancreatic cancer, many of which are often overlooked. The good news is, according to recent research, detecting 3 of these signs at the same time can increase the chance of early diagnosis by nearly 70%. So why is such a deadly disease so overlooked? And why isn't this knowledge more widely available? If you found the video helpful, please like and subscribe to continue receiving important health information. Now let's start with the first sign. 1. Persistent digestive disorders, a sign that is often overlooked. One of the earliest signs of pancreatic cancer, but often overlooked, is persistent digestive disorders. Because the pancreas is responsible for producing digestive enzymes, when a tumor forms, it can reduce the ability to secrete enzymes or block the flow of enzymes into the small intestine. As a result, you will experience symptoms such as bloating, nausea after eating, indigestion, and especially loose, shiny, foul-smelling, pale stools, due to unabsorbed fat. If this condition persists for days to weeks without improvement despite changing your diet, you need to pay attention. In addition, feeling full quickly, loss of appetite, and unexplained weight loss are also consequences of poor digestion. These symptoms are easily confused with common stomach diseases or digestive disorders, leading to subjectivity and not going to the doctor in time. Many pancreatic cancer patients later recounted that they had abnormal digestive signs very early on, but no one thought it was a sign of a dangerous disease. Therefore, if you often have digestive problems, especially when the color and texture of the stool changes, indigestion, prolonged nausea, take the initiative to go for a checkup. Do not ignore the silent recurring symptoms, because sometimes they are the first warning that the pancreas is trying to send you. Early detection of pancreatic cancer is very difficult, but not impossible, and listening to small changes in the digestive system is one of the ways to help you protect your health before it's too late. 2. Persistent fatigue, a silent warning sign of pancreatic cancer. Fatigue is a common symptom in modern life. However, persistent and unexplained fatigue, even after adequate rest, can be a warning that you should not ignore, especially in the context of pancreatic cancer. This is not the kind of fatigue caused by overwork or a night of sleep deprivation. This is a feeling of total exhaustion, as if your energy has been drained. Simple things like walking slowly, climbing a few stairs, or doing housework become heavy, and fatigue lasts for days without improvement. Pancreatic cancer can cause the body to expend energy to fight the growth of cancer cells, while also affecting the ability to metabolize and absorb nutrients. As a result, even if you eat normally, your body is still exhausted and weak. Not only that, this condition is also accompanied by sleep disorders, feelings of anxiety, depression, or even loss of motivation to live. This is the reason why many people mistake it for depression or normal stress, leading to ignoring a dangerous sign. 4. Sudden appearance of blood clots, a hidden and dangerous sign. When it comes to pancreatic cancer, few people think of blood clots. But in fact, this is one of the silent and extremely serious signs. Did you know that pancreatic cancer can change the way blood clots in the body? The tumor can stimulate an inflammatory response and increase the risk of thrombosis, that is, blood clots, forming in the veins. One of the common complications is deep vein thrombosis, DVT, which often occurs in the legs. You may notice that your legs suddenly swell, turn red, feel warm and painful to the touch. In particular, these symptoms are not caused by trauma or strenuous activity, but appear suddenly and are difficult to explain. More dangerously, if this blood clot moves through the bloodstream and gets into the lungs, it can cause an extremely serious complication, pulmonary embolism. When this happens, the patient may feel severe shortness of breath, sharp pain in the chest, or even a feeling of suffocation as if unable to breathe. In addition, the heart rate may increase abnormally, causing you to worry or panic without understanding the cause. This is a situation that requires emergency medical care, because pulmonary embolism can be life-threatening in a short time if not treated promptly. Many people often mistake these symptoms for fatigue, lack of exercise, or common illnesses, but in fact, the sudden appearance